Dear colleagues, ladies and gentlemen, it's a big honor and great opportunity to me to participate in this big event with my topic, the use of transobturator adjustable sling for the treatment stress urinary incontinence in morbidly obese female patients. My name is Azimjan Tursunkulov. I am from Tashkent, Uzbekistan. Stress urinary incontinence is a non-controlled loss of urine during coughing or physical activity, mostly due to a weak pelvic floor or urethral sphincter and having a significant impact on the patient's quality of life. Sling surgery is the gold standard in the surgical treatment of stress urinary incontinence. Unfortunately, despite with the higher results of the surgeries, about 20% of patients are incontinent postoperatively, and this situation is common in obese patients. In this study, we evaluated the results of surgical treatment of stress urinary incontinence in morbidly obese patients with transobturator adjustable sling. To our study, we included 70 morbidly obese female who underwent transobturator adjustable sling surgery between 2015 and 2019. Perioperatively, all patients were evaluated by STEMI degree of incontinence, cough test, pad use, Q-tip test, and all other standard tests. All surgeries performed by single experienced surgeon. All cases performed under spinal anesthesia by performing cough tests with 300 cc bladder filling after gentle tightening of the sling. Special attention is paid to the prevention of overcorrection. The control readjustment was performed under local anesthesia by the next day after surgery if it required. Mean age of patients was 55. Patients with prior pelvic floor surgery was 32. Grade 3 stress urinary incontinence was in 47 patients. Grade 2 stress urinary incontinence was in 23 patients. Preoperative pad use daily was 5.7 in each patient. The mean operative time was 25 minutes. No intraoperative complications like bleeding, bladder injury. 31 patient was continent. Readjustment of sling performed next day after surgery for 39 patients who had signs of urinary incontinence during cough test. All patients were continent after readjustment with no residual urine. 6 patients felt pain after surgery which controlled by painkillers. Hospital stay period was 2 days for all patients. Mean follow-up was 12 months. Overall success rate was 95%. 2 patients had one pad during 24 hours and 1 patient no feedback. Our series demonstrates that the use of the adjustable transobturator sling is particularly beneficial for obese patients. In morbidly obese patients, a considerable success rate is achievable with the transobturator adjustable sling surgery. The procedure can be regarded as safe as no complications were observed in this group of patients, in part with multiple risk factors. My concluding message is the individual adjustability of the sling in order to achieve an adequate degree of the tension to the urethra is the key factor in restoring continence in the selected cohort of morbidly overweight patients. Thank you for your attention.